Hey everybody, thanks for watching this episode of CyberMD, where we'll be covering the physics of flow for the USMLE Step 1 exam as it pertains to vasculature in the human body. The cardiovascular system is responsible for circulating blood throughout the body. Blood flow is driven by the contraction of the heart, which creates the pressure that pushes blood through the blood vessels. The resistance that the blood encounters as it flows through the vessels is an important determinant of the pressure required to maintain flow. The blood's flow rate is determined by the velocity as well as the cross-sectional area. Additionally, the blood moves due to a difference in pressure gradient. When the blood is ejected from the left ventricle, there is a force exerted to force it into the aorta, which creates a pressure within the lumen of the aorta. Additionally, the arterioles are elastic and expand as blood is squeezed into them, but then contract back down, further helping to create a pressure gradient within the arterial vasculature. This is extremely important to know, as the arterioles produce the vast majority of the total peripheral resistance. On the other hand, the venous system is comparatively loose and floppy, making it a low-pressure system. This comparatively loose, floppy, low-pressure system makes the venous system excellent at storing the majority of our total blood volume. This difference in a high-pressure system on the arterial side and a low-pressure system on the venous side is what drives the flow of blood. In the vasculature, there is also a resistance to flow, as described earlier. Resistance in the cardiovascular system is often referred to as total peripheral resistance and is mainly determined by the size and number of blood vessels, but is also affected by other factors. The smaller and more numerous the blood vessels, you would think that the greater resistance to flow would be. Keep in mind that it is the total cross-sectional area in the system that matters. For human physiology, this is extremely important, as the total cross-sectional area actually increases as the size of the vasculature decreases. This means there is a decrease in the velocity of the flow in order to maintain a steady flow rate throughout the system. Why is this necessary? Well, as our blood enters the capillary beds, it needs time for oxygen and nutrients to diffuse, so there is an increase in total cross-sectional area in order to decrease the velocity and allow for these exchanges to happen. It is also worth mentioning here that increasing the radius of a vessel decreases the resistance dramatically. According to the formula, a doubling of the radius decreases the resistance by a factor of 16. Be aware of this effect. In addition to this, resistance is significantly lower if the vessels are in parallel rather than in series, as shown by the equation on the slides. Notice how the vessels in parallel look like the branches of capillaries. This is another mechanism by which the body reduces the resistance to blood flow to help supply oxygen and nutrients to the tissues. In addition, the viscosity of the blood can affect resistance. Viscosity is determined by a number of factors, including the concentration of red blood cells and plasma proteins. When these factors increase, the viscosity of the blood also increases, leading to increased resistance to flow. Let's imagine a scenario where a person has increased red blood cells in their blood, also known as the hematocrit. This increased hematocrit will increase the viscosity of the blood, making it thicker and more resistant to flow. This increased viscosity can make it more difficult for the heart to pump the blood and for the blood to flow through the small vessels. This is one of the main reasons why in conditions like polycythemia, a condition where there is an abnormal increase in the number of red blood cells, as well as dehydration, where there is decrease in fluid content of the blood flow is affected, and these can lead to cardiovascular complications and other organs becoming less perfused. Similarly, increased plasma proteins in the blood, such as in conditions like multiple myeloma and systemic lupus erythematosus, can also lead to increased viscosity and resistance to blood flow. On the other hand, however, a patient who is anemic and therefore has a low red blood cell count will have a decrease in viscosity and therefore resistance. The smoothness of the vessel walls can affect resistance as well. The smoother the walls, the less resistance to blood flow. Another important factor to consider is the flow pattern, which can be either laminar or turbulent. Laminar flow is a smooth, orderly flow pattern where the blood flows in parallel layers with little mixing between layers. This type of flow typically occurs in larger blood vessels, such as the aorta, and is characterized by low resistance to flow. On the other hand, turbulent flow is a chaotic, disordered flow pattern where the blood mixes and eddies. This type of flow typically occurs in smaller blood vessels, such as those affected by atherosclerosis. It is characterized by increased resistance to flow and increased risk of thrombus formation and hypertension. Let's imagine a scenario where a person has a condition such as atherosclerosis in which the vessel walls become thickened and lined with plaques. These plaques can cause the vessel walls to become irregular and less smooth, increasing the resistance to blood flow. This increased resistance can make it more difficult for the heart to pump blood and can lead to hypertension, as well as the aforementioned risk of thrombus formation. On the other hand, a healthy vessel wall is typically smooth and elastic, allowing blood to flow through easily with minimal resistance in a laminar pattern, maintaining healthy blood flow and blood pressure. It's important to note that the smoothness of vessel walls and flow pattern are not the only factors that affect resistance, but they are important ones. To maintain healthy blood flow and prevent complications, it's important to address any conditions or risk factors in our patients that can damage the vessel walls and change the flow pattern. For a quick recap, increases in pressure, viscosity, length, and vasculature in series all increase resistance. Conversely, decreases in these same factors may decrease resistance. In summary, be aware of how pressure, blood viscosity, vessel length, vessel radius, total cross-sectional area of the vasculature, vessel wall smoothness, and a series versus parallel system can affect the total peripheral resistance. Thanks for watching, and don't forget to subscribe to our content.